Welcome back into Talking Fitchburg. Got a very special interview for you today. We're going to be talking about falls prevention with two of what I think are the experts in this. Well, at least one of them, Jeff Doslick.
No,
You
no.
know, he's just deputy chief.
Ashley.
I don't know. Ashley Hillman is here as well from Safe Communities and brings just a wealth of knowledge and a friend of the show too. Ashley, it's been quite a while. How are you both doing today?
We're good.
Good, doing good.
All right, you guys ready to
Thanks for
talk about?
having us.
We're excited to have you and talk falls prevention. I think this is a great topic. Personally, I rode on an ambulance for many years, and the number one calls that I went to were falls, and it's everybody. It falls affect everybody. And I think, Ashley, one of my favorite quotes that I learned from you over the years of talking with you about this is, as you age, it doesn't mean you need to fall. Like, falls are not a part of aging. So as you look at falls and fall prevention, Ashley, let's just talk about, why do falls happen in the first place?
That's a really, yeah, that's like the million dollar question. So I think there are several reasons. And if we look at what the Centers for Disease Control says are effective falls prevention strategies, we can see what are oftentimes the cause of falls. So that can range anywhere from home safety. So making sure you don't have clutter in the home, you have night lights, you get those throw rugs off. You're not reaching up on stools to change light bulbs. So there's a whole home safety aspect, and then also medication. So oftentimes as we age, we start to, take more medications, whether that's over the counter, prescription, supplements, vitamins. And sometimes those start to interact in a way that may cause you to feel lightheaded or dizzy, which could then result in a fall. Safe footwear, making sure that we're not wearing high heel shoes anymore, or ever, is probably just a good practice. And then also using helpful devices like yak tracks when you're walking on ice or in the snow. Vision is a big factor that comes into play. Your vision changes all the time, and making sure you get regular vision checks is really important. And then, strength and balance is huge. So making sure that you're continuing to build and use the muscles that help you sit down into a chair or get up from a chair or step onto a curb. That's really important to help prevent a fall. So those are just kind of some of the factors that are predictive of falls, but then also I think being mindful, just being aware of your environment and of your body in space, and just taking a moment to think before you carry 2 bags of groceries up the stairs, things like that.
Ashley, Wisconsin, I believe, still leads the nation in falls. Is that because of the weather, or is it other factors?
That's another million dollar question.
Hard
A
questions
lot
here
of
today,
people
Ashley.
people make assumptions about why that is. Winters are long in Wisconsin. So some people say vitamin D deficiency, just really tough winters with ice and snow, people being more inactive during those winter months, which, that's the whole strength and balance piece. But one thing that we keep coming back to after many conversations with local physicians and even the CDC is that Wisconsin does a really good job at reporting falls. And I'd like to give this example. A physician told me once that she had a patient who fell and then entered the hospital. And then throughout the course of that hospital stay, that patient developed pneumonia, an infection, and then eventually died. But the cause of death was reported as a fall and not all of those other issues that transpired along the way. So, it could be, yes, that Wisconsin does a good job at reporting fall related deaths, but I think if that is still the case, we have a huge issue with falls in Wisconsin, and we are the number one cause, or Wisconsin is number one in injury related deaths due to falls. And I'm sure, Jeff sees this every day in his day to day. So, whether we report it well or not, it's an issue that we all need to be paying attention to.
Ash, you got right to where I was heading next. And Jeff Doslick, Fitch-Rona EMS, is the deputy chief. And Jeff, when we look at the numbers that come in for falls, it's pretty startling, and it's right here in our district.
Yeah. Yeah, I think this segment's really timely. National Fall Prevention Week or month is in November, I believe. And the report came out from the state of Wisconsin. And, when I looked at our numbers for 21, 22, and 23, it's similar to what the national average is. So we see about amongst older adults 65 and older account for 17% of the 911 calls across the country. If I look at our numbers here for 21, it was 15%. For 22, it was 16%. And currently for 2023, it's trending at 16%. So for the most part, it's the second leading cause of calls to the 911 behind the sick person. And, when we take a look at the COVID related responses that we've had over the last couple of years, a lot of those responses fell into the category of sick person. If we took those calls out of our system, falls is the number one call that we go to with Fitch-Rona EMS in our district.
That's again pretty startling numbers there. And when we're talking about prevention and why it's so important, Ashley, why is Safe Communities all over this? Is it because of the numbers? Is it because of we know the answer to this, but more importantly, you guys are doing what you can to help get that information out to stop this.
That's right. Yeah. So at Safe Communities, we develop coalitions around the top causes of injury, death in Dane County. And one of those is falls among older adults, which is why we're, building coalitions around this area and trying to do what we can to change those numbers by a couple different strategies. So at the grassroots level, are we making programming accessible to all older adults? So, all areas of the county, all populations of older adults, like, are we really making programming accessible so that people can engage in those programs? And then at the systems level, are we working with Jeff, and are we working with the hospitals and healthcare systems so that we're all working together towards a common goal of keeping people upright and healthy? And that's a big task. And I think some of the ways we can do that is by holding events. We've had several falls prevention events just this month that are free, accessible to the public, and just to kind of help people realize that they don't have to fall. And also, when you think about aging, I think was having a conversation recently about reimagining aging here in the United States and in Wisconsin and in Dane County, where it doesn't mean you can't live the life you want to live as you age, but you just rethink the way you do things. And it doesn't have to be a negative thing. And I think there are things you can do to stay safe and healthy so that you can live the life that you. So I think a lot of it's education, awareness, and accessibility.
Jeff,
I'm sorry.
sorry, go ahead. Nope, go ahead, Jeff.
If you take a look at the numbers in 19 counties specifically, but the state of Wisconsin, we think of older adults in nursing homes are the ones that are falling, and that's really not the case. The majority of the falls that occur are private residence calls by a significant amount. And I think, going back to the programs that Safe Communities does, is trying to target those areas where people are a little bit more complacent in their around their home and such. And we don't really think about that. That number was startling to me. The numbers in the house and
that actually is where I was going to go with the questioning, and a good question for both of you is how do you break the I'm never gonna fall, I'm just cause I'm okay, I'm fine, I'm taking a few meds, I'm getting older, yeah, whatever, I'm gonna do this right. The statistics say yeah, no.
Yeah, I think just doing what we're doing here today and starting the process of having conversations, the Fall Preventions Task Force that Ashley chairs for Safe Communities, and it is a is a great place to get the information out. And we brainstorm a lot about how to do this, and the Stepping On program, getting the information out to the community like we're doing now, the report that came out from the state of Wisconsin recently, that's releasing that information and really bringing awareness to what falls can do. And the thing that really sits with me is that it's not, that there's a lot of numbers and there's a lot of people that fall and they don't get hurt, and they're counted as falls, and we write ambulance reports on those. But I don't think we always think of what the downstream effect of that fall might be. So Ashley brought up a good example earlier. Somebody goes to UW for a fall, and within a month the person is now dead because of that fall. And the cost to society, not only emotionally but financially, I think is huge, and we don't always think about that from our perspective. We think about a number and transporting somebody and they pay an ambulance bill, but what about the rest of their life that's affected by the fact that maybe their sidewalk was a little bit uneven in front of their home, or maybe the rug was a little bit frayed in their house between the living room and the hallway to their bedroom, and they trip and fall and hit their head, and now they're out of commission for a while. I know when we met with the QA committee for the consortium, our consortium that we're part of, it was brought up in that committee, the concern that UW Hospital's trauma center has about seeing these numbers, which they've tracked for a while, and knowing that what are their trauma services going to be able to do if this continues, and are they going to be able to take the influx of the number of people that are falling and literally spending weeks or months or more than that in the hospital as a result of a simple fall that most likely could have been prevented.
Yeah, absolutely. Ashley, do you have any comments on the topic?
Yeah, I'll just add, well, yes to everything Jeff said. But then I think some people don't realize that, yes, they also could be at risk of falling. Whenever we talk, about stepping on or have speaking engagements in the community, we always do this falls risk assessment with people, and we go through these questions. And I think people are oftentimes very surprised at what they score at the end of that assessment, that tells them, yes, they also are at risk of falling. And it's questions like I may have to rush to the restroom, or I'm fearful of falling. If you're afraid of falling, that's a predictive factor of a potential fall in the future. So I think people just don't think that, yes, it could happen to them. And so that's a whole part of the education and awareness piece too, that, yeah, it could, but that's why we're here, is to prevent that from happening and to help you prevent that.
And that's where we'll spend our last remaining time here today, is finding the resources to prevent falls. Ashley, if people want to get involved with some of the programs you talked about, or take you have that assessment online, by the way. You can take that risk assessment right now. But if people want to get resources on this or ask questions, how can they do that?
Well, you can go to our website. We try to really provide information about all classes that are happening, all sorts of programs, resources like home safety assessments. And you could just Google Safe Communities, Dane County, Wisconsin, or it's www.safercommunity.net. And then you should be able to find everything there. And I'll also say that one of our partners in the community, the Wisconsin Institute for Healthy Aging, they also have a new falls-free center, which provides, you can do a virtual home assessment and identify some of the things that could be changed in the home or made safer. There's a lot of great resources there as well. So, and again, we've got that information on our website, or you can always call me too.
Yeah, go right to the source. Call Ashley. She'll take your calls right now. No, we'll save that for a day. It's good. Jeff, from your standpoint, Fitch-Rona EMS, as we deal with this day to day, what resources or information can Fitch-Rona provide with this partnership with Safe Community, certainly, but just from your guys' perspective on safety?
Yeah, so we're knowing that the numbers are now, and we've always kind of thought the numbers were high. But our statistics and those with the state also show that. We'll be putting information out on our new website, which will be out very soon. When they're in homes, maybe not necessarily, if they have a minute or two to look around and maybe address some of those things that that could be fall risks that they can mention to the homeowner or to the patient, especially if it is a fall. These are the preventive things that they can do, and then get that information back to me or have information available to the patient or the resident of that home, directing them over to Ashley and Safe Communities.
Well, thank you so much, both of you, for the great knowledge. Love getting together and talking with you. Wish we had more time to go through things, but you've laid out some great resources, some great information today, and we'll get you both back on the show real soon and keep having these discussions.
Awesome.
Thanks, Jeremy.